Hello guys, welcome back to Pharma Palette. So today in this video, we will be discussing completely about blood clotting. So by the end of this video, you will be getting to know what is a clot, what are the list of clotting factors, what are the various pathways involved in it, the exact process of clotting. So without any further delay, let's get into the video. So, before knowing the details about the blood clotting, we have to know some important terms. So, first thing is clot. So, what is a clot? Simply the blood clot. It is defined as the mass of coagulated blood which contains the RBC, WBC, platelets, which are all entrapped in the fibrin meshwork. So, that is called as clot. Second one is coagulation. So coagulation is simply the blood clotting. So here the blood will be changing from the liquid state to the gel form. So when this formation occurs, it leads to the blood clot. This will be resulting in hemostasis. So what is hemostasis here? It is simply the stoppage of bleeding. And next term is thrombosis. Thrombosis is simply the formation of blood clot. So here this will be also called as the thrombus, which will be circulating in the blood vessels. So coming to the clotting factors. So just remember one thing here, there are 12 clotting factors. The only difference is the sixth clotting factor will be removed. So when there is no sixth one, directly 7, 8, 9, 10, 11, 12, 13 will be there. Now let's try to remember all the clotting factors with simple tricks. So there are totally 12 clotting factors. In that, the sixth clotting factor is absent. So totally there will be 13 Roman numbers. These below sentences are the tricks. Just divide these factors into 4, 4, 4. Okay, in that first one is 1, 2, 3 and 4. So here remember one trick, which is fresh pro teacher has calcium. Fresh pro teacher has calcium. So first thing is F. So the first factor will be fibrinogen. So the second one is pro, which is P. So here the second factor is prothrombin. Third one is T, which means the third factor is tissue factor. Fourth one is C. C means it is calcium. So the first four are done. So first four factors, how do you remember them? Fresh pro teacher has calcium, where F means it is fibrinogen, P means it is prothrombin, T means it is tissue factor and C means it is calcium. Now coming to the next four, which is 5, 7, 8, 9. Sixth factor is not there. So here remember the trick, labile students prefer anti-A Christmas. Labile students prefer anti-A Christmas. So here labile means the fifth factor is called as the labile factor. Seventh factor, S no, S means it is stable. Seventh factor is stable factor. Then we have eighth factor. Here you remember it as anti-A. Eighth factor is anti-hemophilic factor A. Anti-hemophilic factor A is called as the eighth factor. Now coming to the ninth factor, which is the Christmas factor. Now coming back to the next four factors. So here remember as start explains hegemon stabilizer. Start explains hegemon stabilizer. That means, so here start means the 10th factor is start factor. So it is called as start prover factor. Then the 11th factor is explain. So here you take P word. Plasma thromboplastin antecedent factor. Then the 12th one is hegemon factor and the 13th one is fibrin stabilizing factor. So generally there are three pathways of coagulation. So the first one is the extrinsic pathway. It will be intrinsic pathway and the common pathway. Now all these three pathways, they will be together, they will be forming a stable blood clot. So how does this stable blood clot forms? Let's see each pathway in detail. So the first pathway is extrinsic pathway. So here you have to remember few simple points. So first thing is this pathway will be mainly initiated by the injury of endothelial tissue. So whenever there is injury in the endothelial tissue, which is the skin layer, so this will be first activating the factor 3, which is the tissue factor. So this will be activating the tissue factor which is present in the blood. So this will be further binding to the calcium and factor 7A, which is required to activate factor 10 to 10A. This factor 7, whatever is there, this will be present in the blood. This will be needed for the vitamin K activation. So what all points will be including in this? So whenever there is an injury to the endothelial tissue on the skin, this pathway will be initiated. In this, there will be activation of the factor 3, which is a tissue factor which is present in the blood. So further, it will be binding to the calcium and also factor 7A, which is required to activate 10 to 10A. And this factor 7, which is present in the blood, is required for the activation of vitamin K. That's it. So coming back to the second pathway, which is intrinsic pathway. So initially this pathway will be beginning once the hegemon factor is exposed to the endothelial collagen, kallikrein, HMWK, which is the high molecular weight kininogen. So here this will be it will be starting with the factor 12, which is hegemon factor. So this factor 12 will be activated into 12A. Now this 12A factor will be further activating factor 11 to 11A. This further binds to the calcium molecule, then again activates the factor 9 to 9A. And now in the blood we will be having 9A factor, 8A factor and a calcium molecule. All the three together they will be forming a complex which will be further leading to the activation of factor 10 to 10A. Now what all are present in the blood? The factor 8 will be found in the blood, and this will be activated by the thrombin, which is simply the factor 2A. Now here it will be a bit confusing. Once you see the flowchart, it will be easy. So coming to the third pathway, which is the common pathway. Pathway is generally initiated after the activation of factor 10 to 10A at the end of both the pathways, intrinsic and extrinsic. And this pathway will be beginning when the 10A, 5A and a calcium, all three bind together to form a prothrombin complex. Now this complex will be further activating the prothrombin to thrombin molecule, which is factor 2 to factor 2A. So once the prothrombin complex activates the prothrombin to thrombin, this will be further cleaving the stabilizing factor. So this will be cleaving the stabilizing factor. So now again there will be conversion of factor 13 to 13A. Now this 13A will be binding to the calcium molecule. Then this will be making the fibrin crosslinks. Thereby it will be causing the stabilization of clot. That's it. Or let's see all the three pathways with one single flowchart. With the help of this flowchart, you will be easily understanding the coagulation cascade, all the three different pathways which are involved in forming a stable blood clot. As mentioned earlier, it will be having three pathways. So one is the common pathway, intrinsic pathway and the extrinsic pathway. In the extrinsic pathway, so this extrinsic pathway will be initiated whenever there is an endothelial damage to the skin layer. So this will be first activating this third factor that gets converted into 3A. That 3A along with the calcium molecule, and it activates factor 7A. All these three together they will be activating the factor 10A. Till the factor 10A activation, this extrinsic pathway will be there. And coming to the intrinsic pathway, so this will be beginning whenever the factor 12, which is the hegemon factor, gets exposed to the collagen or kallikrein or HMWK molecule, which is nothing but high molecular weight kininogen. So all these three together, they will be activating the factor 12 into 12A. Now this 12A factor gets converted into, will be further activating 11 to 11A. So with the help of calcium molecule, it will be again converted into 9 to 9A. When these two factors are activated with the help of calcium molecule, and here what is there? So we have factor 9A, there is factor 8A and a calcium molecule. So 9A, 8A and a calcium molecule together, they will be forming a complex in order to activate this factor 10 to 10A. So that is all about the intrinsic pathway. Now coming to this pathway, so this entire thing we will be calling it as a common pathway. So what happens now? Our 10 factor is activated, so this will be initiated after the activation of 10 to 10A. Then this begins whenever this 10A, 5A and a calcium molecule binds together. When 10A, 5A and calcium, when all these three are binded together, this will be activating. So what happens? This will be further leading to the formation of prothrombinase complex. After that prothrombinase complex is formed, it will be activating prothrombin, so which is simply the factor 2. So after this prothrombin is activated, it gets converted into thrombin, which is a 2A factor. So here this is called as prothrombin, 2A is called as thrombin. Thereby, with the help of this calcium with 13A factor and factor 1A, all these three together, they'll be leading to the formation of a stable fibrin clot. So in the exam, if you are writing this answer, make sure that all these clotting factors should be written in the Roman numbers, not in the numerical values. They have to be written in Roman numbers. So that is all about the complete video. So this is a major big video where you got to know what is a clot, different pathways and the process of coagulation, the coagulation mechanism, the list of various clotting factors and how the clotting is getting done, and what is the flow chart with some definitions. If you found this video informative, don't forget to like, share and subscribe to Pharma Palette. See you all in the next video and thanks for watching.